So what are the factors of having ADHD that can predispose somebody to develop a BFRB? So one, we know that people with ADHD have poor impulse control. So the parts of, let's say a non-ADHD individual that might see something on their nail that they might want to bite, or there's that scab there, but they know, the scab is meant to, basically cover up the new skin that's supposed to be created and healed. So I'm not going to pick it. They have good impulse control. People with ADHD lack that impulse control. So it's that pause button or that stop button just isn't working in the same way. BFRBs can also be very hyper-focusing. What I've heard from my ADHD patients is almost like that they get lost in it, and there's almost something very grounding and soothing for them about just being focused on one thing. And for any of us with ADHD can relate to that there's sometimes a lot of noise in our head when you have ADHD, and there's something about having anything that is that thing that grounds you. Now, of course, as we'll talk about later, we want healthy, positive things to be that grounding force. But there's no doubt that this is something that grounds people, that they feel anchored. And that's sort of a key feature for ADHD is individuals that'll say, I don't like doing the behavior. And at the same time, there's something about just having to think about or focus on one thing. It can be stress relief, especially for people with ADHD who have 30% of people with ADHD have a comorbid diagnosis of anxiety or an anxiety disorder. We know that executive dysfunction can cause a lot of stress. So anything that creates stress relief is going to be highly rewarded and reinforced in the ADHD brain. And BFRBs, while the person is engaging in them, can be very much stress relieving. Post BFRB, when the consequences are on display, it's obviously creates more stress. And despite the pain, I mean, I have had a lot of patients over the years that say it's very painful even when I'm doing it, but it's stimulating. And what I always say about ADHD is, with ADHD, because we're in a dopamine deficit, I think of ADHD as an orientation to the world in some ways. Is I am oriented to the world by what is going to stimulate me. And everything that's pleasurable is stimulating, but not everything that's stimulating is pleasurable. Pain is stimulating, conflict is stimulating, danger is stimulating. They're not pleasurable, but the ADHD brain would rather lean into those more unhealthy forms of stimulation than to feel nothing, than to feel bored. So this is arousal. BFRBs are highly arousing for an under-aroused ADHD brain. Now, there are a number of individuals who engage in BFRBs where it's quite mindless. They don't even realize that they're doing it until the consequences sort of show themselves. So a lot of times that could be while they're engaging in other activities, watching TV, driving, sitting in class, activities that might not fully anchor them or fully ground them, that it's similar to fidgeting, that we know that fidgeting is a way for people with ADHD to almost stimulate their frontal lobe when they're not getting enough stimulation that they need some grounding. This is sort of a form of that. ADHDers we're sensory seekers, and this is absolutely the definition of sensory seeking behavior. I mean, with BFRBs, you are touching, you are looking, you sometimes are tasting, that there's, even the sounds of the nail biting. I mean, I've had patients report on all of those aspects of what can be very reinforcing. The other thing is that these behaviors are very goal-oriented in a strange way, but they are. I mean, if somebody has this, let's say a pimple that they want to pop, and it's perhaps a whitehead that's not right at the surface of the skin, but is underneath the skin more, and they're, pushing and popping and pushing, and then it finally pops out. What they report is a sense of accomplishment, like this win of, yeah, I got it out. And despite the fact that they might now have caused blood and scarring, and an hour has gone by. Similarly, when people pull certain number of hairs and things like that, that there's this sort of win associated with it because, again, of that stimulation. It does elevate dopamine in the brain. The other thing is that the presence of any unwanted hair or skin or nails can be quite distracting. Sometimes patients will report that the only reason that they're doing it is to just get rid of it so that they can continue on what they were doing. So if, let's say, somebody has, a scab and they're trying to get their work done and the scab is a little itchy, they think, you know what, let me just pull it off and then it won't be itchy anymore and I can continue with what I'm doing. So it's almost that the BFRBs are driven by the fact that they're just so distracting to the individual. Sometimes people talk about the BFRBs as like fidgets, like almost like oral or manual fidgets. When I was a kid, I used to bite the inside, the inside of my cheek. I can still feel the scarring actually in my cheek, but that was absolutely an oral fidget. I mean, I would do that when I was in class, bored out of my skull. And that was, one of those things that just, I felt like had a rhythm to it. I'm a music lover, so everything is in music in my head, that I would sort of chew my cheek almost like to a certain rhythm. Now, BFRBs, that's not to say that OCD is not present or that it can't be in the mix as well. We know that ADHD and OCD are more comorbid than we think. So we also know that people with OCD and the sort of rituals can be with BFRB. So I've had patients who I've worked with who will talk about engaging in the BFRB as a ritual of their OCD. So sometimes it's, I need to pull 10 hairs or else something bad is going to happen to my mom. So it's very tied into their OCD as opposed to some of these more ADHD related triggers. Individuals can sometimes, these BFRBs, just like we see with tics sometimes, can sometimes be induced by stimulant use. And we know with tics that it's often that people with ADHD are highly prone to tics anyway, and that stimulants might just kind of put someone over the threshold of it who were already predisposed to it. And that may be the case as well with BFRBs. But for some individuals, they notice stimulants can exacerbate that for them. And we also know that self-esteem issues are very prevalent in people with ADHD, and sometimes the BFRB is a way of soothing that and trying to sort of almost cope with low self-esteem issues.